gains that we have had it not been for their dedication. Being our frontline heroes, I want to assure them that we will do everything possible to provide them with every facility that is necessary to enhance their performance. I also want to thank the Ministry of Transport, Infrastructure, Housing and Urban Development and the county government of Mombasa, and indeed their governor, Governor Joho, for the collaborative effort to provide disinfectant sprayers at Likoni Ferry. Such efforts contribute to the overall measures by the ministry to fight the virus. I would like to encourage other counties to also come up with innovative ways to complement the national government efforts. In the same vein, I also want to take the opportunity to recognize the efforts by the Ministry of Information, Communication, Technology, Innovation and Youth Affairs, together with the Ministry of Education, as well as the Kenya Institute of Curriculum Development, for introducing new education-oriented programs on television and radio to ensure that our children are productively engaged during this period. Further measures to enhance social distancing that we are going to institute must now include even the following. Number one is that in sporting clubs, open-air sporting clubs that have walking fields and so on, must strictly observe social distancing. We have seen people walking, and yes, it is necessary that people also stay healthy, but we must observe social distancing. We have observed in some walking clubs where people are running next to each other, and there is no better way of passing this virus than when they do so. So I would like to ask, and I would like to reiterate, that the managers of those walking clubs must restrict numbers in the club so that people do not, people can be able to keep social distancing. This measure we are going to observe for the next couple of days and may then take further measures if it becomes necessary. You are aware, it's not a secret that even in golf clubs have also been abused. Consequently, all golf clubs must be closed with immediate effect. Golfers are free to walk, keeping social distances, but there will be no candies in any of those golf clubs. In this particular case, it is actually the reverse. It is the members who will eventually pass the virus to the caddies, and therefore golf clubs will remain closed and the clubhouses will remain closed. Further, testing of all health workers and medical staff, including those in private hospitals, rapid response teams, and all staff in all facilities holding quarantined persons must commence testing with immediate effect. I would like to report that we are lucky that we have started rapid testing in our facilities because we have got new reagents that can allow us to automatically test and not do the manual test that we have been doing. And for that reason, we will be able to carry out those tests very quickly. But it is important that we start with our medical staff, even as we fight to ask them that to be careful. We must also now ensure that we do not have medical staff who are also treating people when they have got the virus and therefore passing the virus to citizens. So we must do that with immediate effect. I am pleased to report that over the last 24 hours, three patients who had been diagnosed as positive have been released from our facilities, having turned negative. However, in the same 24 hours, we have tested 696 samples, out of which 14 people have tested positive for the disease. 12 of the 14 are Kenyans, while 2 are foreign nationals. Of the 4 cases, four cases have a recent history of travel from Tanzania, South Africa, UAE, and the United States. 4 of them are from quarantine facilities, while 10 were picked by our surveillance teams. This now brings the total number of those who have tested positive for the disease in Kenya to 172. The 14 people that I mentioned have already been moved to isolation facilities, and contact tracing has begun earnestly. Let me just say this, that my friends, fellow Kenyans, let us brace ourselves for bad news. Let us be ready, because all the measures that we are going to take will not stop the disease abruptly. It is already here with us. There are 2 things that are fortunate for us. One is that the disease that Kenyans are getting is very mild. We have been getting very mild infections, and I'm going to ask Dr. Amos to say a little bit about that. As you can tell, the mortality rate for us has been quite low. But this is no reason for us to be relaxed at all. As we said earlier, we are praying and hoping for the best. But clearly, we must also prepare for the worst. And mentally, we must prepare ourselves to face an insurmountable situation. We must all work together. As I said last week, we are akin to a boat that is sailing towards a massive storm. And we must brace ourselves and be ready mentally. When you go to quarantine, it is very challenging. It is mentally straining. And we are having issues with people who are in quarantine facilities. It is not convenient at all. And my apologies to them for all the inconveniences that they are going through. But it is necessary. So, my fellow Kenyans, we must brace ourselves, mentally be prepared to face a situation that we haven't faced before. But I also know another thing. I know that we were pulled through. I know that we are working together. I have seen effort from quarters that we would never expect. I have seen support from all over. And I have seen people helping each other. That is the way we are going to overcome it. We have now, out of the 14 people that I mentioned, for instance, 7 are from Nairobi. Mombasa has 2 new ones. Machakos has 1. Kisii has 1. Kiambu has 1. And Mandera has 2 cases. And the 2 reported cases from Mandera is a recent travel from Mombasa County. That explains why the decision by the President was taken yesterday to close some of the areas where we feel people moving into and out of are causing further spread of the virus. With regard to contact tracing, a total of 1,928, and by now nearly 2,000 persons have been monitored. We have increased our capacity and our ability to monitor these persons and trace these people. Out of those, 1,415 have been discharged, having tested negative, and 513 are currently on follow-up. To date, we have managed to test nearly 5,000 people. I'm also pleased about the cooperation we are getting from members of the press, members of the media. We are happy that you continue to carry out education, to carry out information, and to keep our people informed about the measures and the necessity of those measures. So please, we ask that you continue to do so. And as I said, we must be ready. This is not going to be a short term. It is not going to be a short-term activity. We are not going to be dealing with this disease only for the next couple of weeks. Let us brace ourselves for the long term. And by a long term, I mean for the next couple of months. We know that people are inconvenienced, for instance, in traveling into and out of Nairobi. We are aware of the inconveniences that happened yesterday, but this is the only way. It is the only way that it can be done, and that is what other nations who have managed to contain the disease, or who are containing, because it is not stopped anywhere. But where they are containing it, these are the measures that they are taking. Kwa hivyo, ningetaka tu kusema, kulingana na vile rais, wale walisoma hotuba ya rais na kusikia hotuba ya rais, yeye alisema vile tutafanya, akasema counties za Nairobi, na Nairobi ni Nairobi Metropolitan Area, Kwale, Kilifi na Mombasa, huko ni lazima watu wakae ndani ya hizo counties, hakuna kutoka. Na pia vile vile wageni wale wangetaka kuja kutembea, kututembelea Nairobi, tafadhalini mtangoja siku ingine, siku 21 kabla hamjaingia Nairobi. Watu wa Nairobi, ndikuwa nimesema hapo awali, ni lazima tukae Nairobi pia, hakuna kutoka hapa, kwa sababu tukianza kutembea huko Ushaguna kwingineko, tutapeleka hii virusi huko. Kwa hivyo kama mimi nasema kila siku, lazima tujikinge, lazima tujitayarishe, lazima tujue ya kwamba hii sio kitu inakuja ipite haraka haraka. Tukiangalia mbele, tunaona ndio tutafanya chochote tuwezavyo ndio watu wasije wakaumia ama kufa, lakini ni lazima tujue ya kwamba kama vile nchi zingine, kama vile kumefanyika nchi zingine, ni lazima pia tuwe tayari hapa katika nchi yetu ya Kenya, kwa sababu tunaona vile kunyafanyika kwingine, na pia tunajua hata hapa pia kutafanyika. Kwa hivyo nataka kuwasihi kila mtu, kumsihi kila mtu, tafadhalini ni tufanye vile serikali inasema. Tufanye vile serikali inasema. Usijaribu. Usione wewe kama ni mwelevu sana. Hii virusi haina mtu mwelevu. Hii virusi ukicheza nayo sio uelevu, ni ujinga. Asanteni sana.
Know about the 21 days restriction period that has been given by the ministry, that has been given by the government. What will be happening during 21 days? Are we going to see mass testing and intensify the contact tracing within 21 days? So that's form then the suspension of that 21 days, or the lifting there rather, and What is then the strategy for these 21 days? You've also announced more counties that continue to register new cases of COVID-19. Are we going to add the said counties of Kisii, Machakos and Mandera to the hotspot counties, and subsequently also invoke restrictions to the same?
Okay, thank you. First and foremost, on the restriction on the 21 days, as I said earlier, the idea is to ensure that we do not take the virus up country and to other counties, because Nairobi has the highest infection rate. So that's the idea. And also for those in other counties not to come into Nairobi and get infected while within. We have not stopped people from moving around within that area. So let's make it clear. We have not stopped anybody from moving around. We obviously encourage people to stay home. If at all possible, stay at home. Work at home. Stay at home. And as I said, it is only good practice. It's good practice because it is better for you to train yourself to stay home. Whatever you need to do, whatever measures you have to take to be able to stay in your house, please do. So whereas we have not closed movement of people internally, because we are trying, we are desperate to ensure that people still can live as normally as is possible under these circumstances, and some commerce can still continue going on, we must also address the fact that there is a limit to how much people can move and how much they can mix. So the restriction is obviously going to be accompanied by other measures. For example, in markets, we have announced, and we keep telling people, when you are going to a market or a supermarket, you know the rules regarding supermarkets. You must have a mask when you are going in there. Any supermarket that, if the health officers go to supermarkets where people don't have masks, then we have no choice but to close those supermarkets. We have said about hotels where we have got quarantined people, and say those hotels must not admit anybody else. That once a hotel has a positive case, it must not admit any other person. And the persons who are in quarantine so that they don't move out. So yes, as I said, mass testing is the next step within those counties. I have said that we are starting with all medical personnel, so that in the event, so that we know, because it is clear, I mean, we are not immune. Medical people are not immune to these infections. And indeed, the probability of having infections within medical people is higher than the other areas. Therefore, we must start with our medical personnel so that we can remove or at least isolate those cases that have got the infection. Want to get better as quickly as possible, because let's also agree that getting the virus is not a death sentence. Let's also agree. It doesn't mean that because you have the virus you are going to die. No, it doesn't mean so, but it means that you can pass it quickly to other people who may themselves die because they might not be as strong as you are. So yes, we will do mass testing with the people, starting with the people, the contacts we have made, the people in quarantine, we are retesting again, the people in the medical field, the people who are workers in hotels, as I said earlier. So the way of containing the measure is essentially to contain it. We have not currently closed the other counties. We are discouraging, I would like to say this, we are discouraging inter-county movement. The only area we are enforcing this is the areas that the President spoke about yesterday. We will enforce it. We have not started enforcing county-to-county movement, but we are discouraging it. If you are staying at home and if you are keeping social distancing, you have very little reason to start traveling from Laikipia to Samburu, or from Nyeri to Muranga, or from Kisumu to Siaya. You have no reason to. So what we are saying is, for the moment, let's discourage any such movement and hope that people stick to doing that.
Hotels within Nairobi. Some of them are actually complaining that the fee they're actually incurring a huge fee per day. I was at a Sheraton today. They're actually paying 9,000 Kenyan shillings. Same to Pride Azure. Maybe
we have told the hotels, and there's a circular that has gone from the DG. We have told the hotels, once you have got people in your hotel who are positive, that's an infectious area. And what you are supposed to be charging going forward is your costs. You're not supposed to be making commercial, you're not supposed to be taking commercial advantages on people, especially who have already stayed with you for 14 days and have been forced to continue again for 14 days. In government facilities, the government is taking over, the food and so on and so forth. But we are discussing with the hotels and telling them that it cannot be business as usual. Therefore, we are encouraging them before we go into control, because if necessary, we will introduce control over how much they can charge. But we are hoping that they can make an amicable solution with those who are staying in those hotels. So, to your point, Kayemba, what we are saying is, let hotels know and let them be told you cannot continue charging people, particularly when they are coming for the second round, the same amount of money. Sorry? You are paying 50,000?
No, 2,000 per day.
Yes, we know. Originally when they came, there are those who are paying 2,000 shillings. After a while, a lot of them have essentially not been paying, and we have not kicked them out. And sometimes we've got to look at this thing on case-by-case basis. Yeah? Okay.
Standard Group. My question is concerning personal protective equipment for the healthcare workers. Is there a consignment of PPEs coming into the country? And if so, when? Is it at the end of this week? What is the breakdown of these PPEs in terms of gloves, face shields or goggles, if any, and the coveralls? What is the distribution plan by the Ministry of Health to the counties and by extension to the healthcare workers, and by what timelines? And lastly on that, are there additional plans to increase PPEs to the healthcare workers, and these plans in terms of amount or the number of PPEs, and what timelines are there? Second, on these healthcare workers, particularly those working in the high-risk areas, that is the isolation centers, is there any reason, public health or otherwise, why they are not in separate accommodation instead of them living with their workplaces, getting into the same matatus and pikipikis like the rest of us, and going back to their homes where they may carry whatever virus they have picked from the healthcare workers? And my last one is a request to you.
Daktari, are you making a speech or are you asking?
Allow me to make one today. The last one is a request to you and your team that when you do your daily addresses, you can break down the numbers for us in terms of not just the new numbers, but in terms of the severity of illness, in terms of those that are mild, those are in critical condition, and the age groups of the people who've been affected by the coronavirus. That will make for better reporting. Thank you.
Let me just say this. On the issue of the personal protective, the PPEs, we will not be needing, nobody is going to lack PPEs in the next 2 weeks. I can tell you that. We have already got consignments for theater PPEs. We have got, this week alone, we have got an additional about 10,000 kits this week. By the end of the next 7 days, we expect to roll out about 200,000 kits. So that's why I'm telling you that I am confident about our ability to supply personal protection. But I would also like to add something here, and it's good that I'm talking to a doctor. He's a doctor who asked the question, that when you get this material, please use it. Please use it. Because we also have our fair share of individuals who are in the medical field who also are quite casual, you know, about the use of this gear. And we have noticed it in certain areas. Obviously, we keep on telling them, you know, they know better. Doctors know better about, and medical personnel know better about the danger that one exposes themselves. So we are saying, yes, we'll ensure that everybody is properly kitted. As we speak, nobody is going anywhere where they are exposed without protective gear. Let me say that. Nobody is going in exposed areas without protection. But what we want to make sure is that it is not just a question of the few who are going to exposed areas. It is everybody. Everybody in the medical field uses them. As I said, we are testing even receptionists within hospitals because we don't know. We are testing even cooks within hospitals. Anybody involved, and going so that we can isolate that. And then going forward, everybody would have the gear to make sure that we have contained any spreads in that in those facilities. I want to ask Dr. Amoth to respond to the other question.
Thank you, Waziri. Let me just start by making a remark regarding the severity of the illness, as asked by Dr. Mercy Korir. As at now, we have one person in critical care unit under ventilation, and this person is doing well. In fact, we have been in contact with the doctors who are taking care of him, and we are looking at a possibility of 1 or 2 days he'll be out of the ventilator. In our previous announcement, there were 2 people under ventilatory support. The other one came out of the ventilator, is up and about. The other persons who are admitted in various hospitals from Nairobi all the way to Mombasa Avenue, Aga Khan, are all doing well. So majority of our cases are still very mild cases. Of course, if you look at the age distribution, the youngest has been 2 years old. The oldest is 74 years old. A male to female ratio of about 56-44. So more men and fewer women. And of course, we know the reason why we have that male-female distribution. Our case fatality rate has been about 2 to 3%, which compares very, very favorably with other countries. In the early stages of the infection, in which case you are dealing with smaller numbers, and therefore the crude death rate or the case fatality rate tends to be low. In terms of quarantine, let me just also add that though this is a painful measure for those whose duration of quarantine has been extended, it is a painful measure that we have to take, but it is for the good of the Kenyan people. I also want to applaud those who actually bore the covenant of respecting the quarantine instructions, those who came like from hotels like Trademark in Gigiri, Hill Park Hotel, where there was no single case that tested positive. And as today, we have started releasing those people home. We want to assure you again, especially those who are in quarantine, to ensure that you follow the social distancing rules, the infection prevention control measures, the hand washing, and very soon we are going to again check on you after the 10th day to see if you are negative. Working together with the county governments, we shall be able to release you to go home and continue with self-quarantine in conjunction with the county health management teams and follow-up from the team at the national level. Thank you. On?
facilities, and why healthcare workers are still going to their homes as opposed to being isolated, yet they're working in high-risk areas.
Thank you. That must have escaped my mind. The healthcare workers, in fact, as of today, following our meeting today with the Syrian peers, we have identified suitable accommodation at one of the hotels, is Hadassah Hotel, just next to Nairobi Hospital, for the healthcare workers. And the team at the Kenya Medical Practitioners Dentists Council, chaired by Dr. Evan Jenga, are working extra hard to be able to get us extra facilities so that healthcare workers who get into contact with these cases don't go home, but go to a specific place and therefore prevent cross-contamination with members of the family and the public as they move home. In terms of the distribution of the PPEs, of course, it is on case-by-case basis. The demand so far in terms of the numbers we have, Nairobi will take a bigger chunk of the PPEs because we have higher numbers in Nairobi, but we'll also be able to deploy a significant number of PPEs to Kwale, Kilifi, Mombasa, Nakuru, where we also have active cases, and any other place where we think, based on a risk matrix that we have developed. Thank you.